Hey guys, it's Dr. John Harbison, and today we're going to talk about rhinoplasty or nasal reshaping. It's one of the most common procedures in the United States and one that we do here all the time at Omaha Face. With board certifications in ear, nose, and throat surgery, as well as facial plastic and reconstructive surgery, had extensive training on both breathing and the aesthetic aspects of this type of procedure. When we're talking about rhinoplasty, it's generally divided into two different approaches. The first, in the original approach, was endonasal, where all the incisions were made inside of the nose. This allowed for a slightly faster healing time and no external incisions. However, gave some limited access to the nasal tip and was largely reserved for more resection and carving sort of techniques. With evolution, we've learned that the healing is a little more predictable, the breathing is a little bit better with more cartilage grafting and more of a structural type approach, which is traditionally performed through an open type of approach where we make a small incision through the base of the columella, connected with some incisions on the inside of the nose that give us some access to all the nasal framework. Now, this is important because the nasal framework underneath our skin is what gives the nose the majority of its shape. And so it's the reshaping, carving, or reorienting of these structures underneath that are going to help us make the cosmetic and breathing changes if necessary. This whole procedure takes about 2.5 to 3 hours in the majority of cases. It's an outpatient procedure where you go home. When you wake up, you have a white cast on the outside of the nose, a couple splints on the inside of the nose, as well as some sutures. And we'll take all that stuff out in about a week. At that point, you're still going to be really swollen, and I always counsel all my patients that that's not what your nose is going to look like. There's going to be some residual puffiness, but really by the 2 to 3 week mark, the nose is looking better than it was before surgery with a little residual puffiness. That last 10 to 20% of swelling goes down pretty slow, up to a year for all of the final swelling to go down, but really most people's noses are looking good within those first few weeks. The types of changes that we make depend on every nose. Every nose is different, but some examples include humps or convexity on side view, wide nasal bones, wide nasal tips, and flared nostrils. These are all things that we address with a variety of different techniques and refinements, which is why it's really important to go to a surgeon who does lots of rhinoplasties, because there's just lots of tools in the bag to help get the ideal result for you. So if it's something you'd be interested in, come see us. Thanks.